Sources like CollegeVine estimate the Rutgers School of Nursing acceptance rate to be roughly 10%, and though this number changes year to year, it ultimately highlights how Rutgers nurses are motivated, driven, and hardworking individuals who strive to excel in their field. In the following slides, we'll discuss how these traits are exemplified due to the high quality nursing education here at Rutgers.
This slide is about Rutgers nursing values. So, the 4 nursing values that I chose to research are integrity, professionalism, social justice, and compassion. To start off with integrity, students enrolled in the School of Nursing at Rutgers, New Brunswick are required to compel to the academic integrity policy. Only honesty and staying true to your values is permitted. No plagiarism or copying other work that is not yours. Moving on to professionalism. Professionalism is a key nursing value at Rutgers New Brunswick School of Nursing. Being professional shows how qualified you are to be doing the job. This builds the trust and bonds between patients, leading you to provide the best quality care for your patients. Next, we have social justice. Understanding social justice as a nurse is severely crucial. This value is necessary to provide equal and fair care to all patients, no matter what given circumstances. Treating patients with equality ensures comfort and safety. Last but not least, we have compassion. Behind the brains of a nurse is always a warm heart. Being compassionate towards your patient is the number one requirement when providing care. Your job is to feel and sympathize with your patient and treat them with great kindness, respect, and warmth. This builds the patient-to-nurse relationship, and it makes patients feel very comforted.
Here we have the academic and clinical experience of Rutgers. First off, there's the academic rigor of the program. So, the Rutgers School of Nursing policy qualifies a passing grade for nursing courses to be a C plus or higher. So, these are going to be courses that you're going to see your junior and senior year, but also your sophomore year with courses like nutrition. And then for non nursing courses that contribute to progression, so like psychology and AMP, a passing grade is qualified as a C or higher. Then we have clinical training. Clinical training is an essential component of nursing education, and so at Rutgers we have high fidelity simulations and fully equipped skills labs so that students can practice their skills in controlled settings before entering the real world with real patients. We also have open lab practice so that students can practice across all 3 locations, and they can practice essentially at any location that's convenient for them. Then we have learning opportunities that are made possible by Rutgers. First off, Rutgers offers a wide range of clinical placements, which include hospitals, but also community-based settings, which encourages students to look beyond the traditional hospital route and look at the vast opportunities within the nursing field. And lastly, another opportunity offered by Rutgers that stood out to me is the course called Transition to Professional Practice, which is completely designed to prepare students for the workforce, which is an amazing course to see incorporated into the curriculum.
Leadership and advocacy. I have 4 bullet points as to why this is so important to be a nurse, let alone a Rutgers nurse. First, I have communication and collaboration, and with that, leadership helps build strong communication amongst you and your coworkers. This can help improve your patient's care as well as potentially reduce any errors in a hospital. Second, we have policy advocacy and improvements. With that, nurses can help with influencing any decisions that are being made with a patient's health. Nurses are very important and play a big role in hospitals. So for that, policy advocacy plays a role in allowing the nurses to get the professional recognition that they need to promote the health care of their patients. Third, building trust within relationships is engaging with other communities and can help build trust within a nurse and their patient. Trust is extremely important and in these environments because you're dealing with many people and their emotions as well as someone else's life. Last, we have leading and safety. Leadership is an important role when being a nurse. Nurses are the key to addressing any sudden issues instantly and making sure that their patients receive the safety that they need. Being a strong leader allows risks and errors to be prevented, as well as making the overall environment safer.
This slide is about diversity and inclusion, and from the in-class presentation, there's 4 key takeaway points that I think that you can use not only in your career as future nurses, but also in your career as students. The first takeaway point is cultural competence, which is the ability to work well with others regardless of race, cultural background, economic status, and other factors. The second takeaway point is diversity, and this quote comes from the Equality Report. It's bringing together people of many backgrounds, beliefs, and experiences to foster a culture of inclusion that enriches the workforce, physicians, patients, families, partners, and communities. The third point is inclusion, which is allowing all people, regardless of background, to feel welcomed, heard, and understood. And the fourth takeaway is equal opportunity, allowing individuals from all cultural backgrounds an equal opportunity to get the care that they need and deserve. And the demographic is from the Equality Report that we got in class as well. And you can see that it's split up into different races, and it's based off of the percentage of diversity inclusion within that race, in the workforce and in the primary service area and the directors and above. And it's about how we can close the gap between the races and make sure that everybody and every environment is filled with diversity and is inclusive of all individuals from all backgrounds.
In this slide, I will be discussing a few ways in how a Rutgers nurse can impact the world locally, nationally, and globally. Locally, us students will soon engage in clinical experiences at hospitals, most likely Robert Wood Johnson. We'll be able to impact the local population during our clinical rotations. We will engage within our community wherever we are by providing medical care, whether we're working as a student at Rutgers or have graduated and are working locally in our hometown. Nationally, nurses are the front lines of patient care, working not only in hospitals, but in schools, homes, and clinics as well. Nurses also contribute to the nation's overall health, especially in disease prevention by administering vaccinations, including like the flu shot or the COVID vaccine. Nationally, nurses can also advocate for policies that aim at improving the healthcare system and policies that address healthcare disparities. Globally, nurses have been heavily relied on. One amazing example of this is the COVID-19 pandemic. Nurses played a critical role in managing patient care, risking their lives during COVID-19. Another way a Rutgers nurse will affect the global population is if they decide to study abroad or participate in travel nursing once they graduate. Working as a nurse across the globe, especially in less fortunate countries, is extremely rewarding experience that will 100% be leaving positive impacts. We can also impact the world globally because nurse educators shape the future generation of nurses all over the world by training and mentoring them, preparing them for wherever their career may take them. I also like to think of our global impact as once we're a nurse, we take on the role of a nurse anywhere and everywhere, so like once a nurse, always a nurse. Now here are some Rutgers alumni that have graduated from the nursing program here at Rutgers that have made an impact in society. First, we have Dr. Rebecca Graboso, who's awarded 2024's Outstanding Alumni. She served by fighting to improve patient satisfaction. Importantly, she also focused on the preventative care of chronic illnesses. Last, we have Dr. Linda Ruth Lynn, who was awarded the 2024 President's Award. She's involved in numerous nursing organizations who have worked in improving the care delivery in diverse medical settings, and she fights to expand the roles of nurses and is fighting to change certain nursing policies.
Future of Rutgers nurses. The Rutgers Pro Nursing Program is ranked #1 in New Jersey. According to U.S. News and World Report Best Colleges 2024, which shows how much a student is important at Rutgers, and especially in the nursing field. And Rutgers also prepare us all types of patients, especially in emergency situations. They give us the best education and make sure we learn everything as much as we can. And they also give us clinical practices and high-tech simulations. Rutgers' advanced resources ensures nurses develop critical thinking, which helps them manage unexpected medical situations. This includes unforeseen situations like pandemics, workforce shortages, and more.